Have you ever been falling asleep or just waking up and thought you heard someone knocking loudly at your door, heard your doorbell ring, or a loud crash like someone's breaking a window? I experienced this a few nights ago when I suddenly awakened to what sounded like someone knocking loudly at my door. Of course I was startled and I laid there awake, listening to see if someone really was knocking at my door at 2 in the morning. My dogs were not barking and I did not hear the knocking noise again. It seemed so real, I just laid there awake saying to myself, what the heck was that? I immediately took to the internet and discovered I had experienced an event known as a parasomnia. A parasomnia is defined as a sleep disorder in which odd or dangerous events occur that intrude on our sleep. Sleep disorders and parasomnias affect many adults and children. If you have a problem falling asleep, or waking up during the night, have difficulty waking up in the morning, or excessively fatigued during the day, you may be suffering from a sleep disorder. What common sleep disorders or parasomnias affect our sleep? How does lack of sleep affect our health? And what can we do to help ourselves improve our sleep habits? According to the National Institute of Neurologic Disorders and Stroke, about 40 million people in the United States suffer from chronic long-term sleep disorders, and another 20 million people experience occasional sleep problems. There are many sleep disorders and parasomnias. However, the following are the most common that affect our sleep. Insomnia. The National Institute of Health describes insomnia as a common sleep disorder. Symptoms include trouble falling asleep, staying asleep for short periods of time, being awake most of the night, or feeling like you haven't slept at all. Snoring may be a problem just because of the noise it causes, or it can be a sign of a serious health issue. Sleep apnea is a condition that causes your breathing to stop or become shallow while sleeping. The most common cause of sleep apnea is a collapse in the person's airway, which obstructs the ability to breathe. Restless leg syndrome is a condition that occurs prior to or during sleep. It causes an uncomfortable, creepy, crawling feeling or a powerful urge to move your legs. Although anemia or pregnancy may cause restless leg syndrome, in most cases, the cause is unknown. Parasomnias include nightmares, night terrors, sleepwalking, sleep eating, sleep talking, head banging, bedwetting, and teeth grinding. A parasomnia such as I experienced when I awoke to hearing a loud pounding knock at my door is referred to as exploding head syndrome. This is an actual syndrome described as a rare and alarming parasomnia in which a person hears a loud bang in their head just as he or she is falling asleep or waking up. The cause of exploding head syndrome is unknown. It appears to occur most often when the person is excessively fatigued or under stress. As we fall asleep, we cycle between 3 phases of non-REM sleep in preparation for REM, which is rapid eye movement sleep. This is the stage in which we dream. Studies have shown dreams are important for our health and well-being. Researchers have discovered subjects who are not allowed to dream experienced increased tension, anxiety, depression, difficulty concentrating, lack of coordination, weight gain, and tendency to hallucinate. Sleep disorders and parasomnias causing sleep deprivation can affect not only our physical health, but it can affect our mental health as well. It can affect our health in the following ways. It can cause decreased performance and alertness, memory and cognitive impairment, relationship stress, such as snoring that disrupts the bed partner's sleep, poor quality of life, affecting your ability to participate in desired activities, job-related injuries, automobile injuries. The National Highway Traffic Safety Administration estimates there are at least 100,000 auto accidents, 71,000 injuries, and 1,550 fatalities attributed to drowsy driving each year. Untreated sleep apnea can result in high blood pressure, heart disease, stroke, prediabetes, diabetes, and depression. If you experience symptoms such as loud snoring, choking, gasping, or witness pauses in your breathing, see a physician as soon as possible. These are all symptoms of sleep apnea. Establishing good sleep habits and getting enough sleep is important for optimal daily performance and health. Keep a consistent sleep schedule, going to bed and waking up every day at the same time. Get at least 7 hours of sleep each night. Only go to bed when you are sleepy. Practice relaxing bedtime rituals. Your bedroom should be quiet, relaxing, and kept at a cool temperature. Avoid eating a large meal before bedtime. Get regular exercise and eat a healthy diet. Avoid caffeine and alcohol in the late afternoon, at the evening, or at bedtime. And limit fluid intake before bedtime. Many people experience some type of brief disorder, sleep disorder, or parasomnia at some point in their life that may affect their daily function or alertness. However, it may not become an issue for everyone. If you or someone you know is exhibiting symptoms of a sleep deprivation, it's important to follow up with your physician. There may be a serious issue involved that could be affecting your physical, mental health, that with treatment could improve your quality of sleep. Determining what's affecting your sleep that may be causing problems such as memory and cognitive issues, daytime sleepiness, chronic fatigue, and even depression is important to maintain optimal health. Parasomnias, such as awakening to a loud knocking or banging noise that aren't there, nightmares, sleepwalking, sleep talking with or without sleep disorders such as insomnia, snoring, sleep apnea, and restless leg syndrome, place people at increased risk of developing physical and mental health issues.